Hi, my name is Stephen Luke. I'm a board certified urologist. I practiced up at the Deer Valley location, which is where the 101 and 17 meet. I've been practicing urology over 20 years. One of my focuses is urinary issues, either male or female. People come to us with a host of different urinary problems. Part of what we do as urologists is first take a good history and then try to get a good diagnosis and give treatment options that's going to work for people that are practical and easy. There are definitely different pathways that urologists can use, but we all kind of follow the same general pathway. Overactive bladder and urinary problems and stress incontinence are very common. It's surprisingly how common they are. It's 1 in 6 people have overactive bladder, which is symptoms of urinary frequency, urinary urgency, and leakage. And it's also surprising sometimes how long people will suffer from these problems before they seek any kind of medical care. Urinary and bowel problems are, they're kind of as you'd expect. It's, having urinary frequency, difficulty getting to the getting to the bathroom in time. And when you have to urinate, getting the sudden uncomfortable urge. There are some, easy conservative measurements that we often start with. Some of them are just trying to minimize caffeine, minimize excessive fluid intake. Sometimes drinking alcohol can exacerbate these symptoms temporarily. How does the bladder work and how is it controlled? How does it control your urinary habits? The bladder has basically two functions. One function is to store the urine, and the other function of the bladder is to empty fairly completely at an appropriate time. So the bladder works with the spinal cord and the brain, and there's a feedback mechanism that's supposed to, when it's getting full, give the spinal cord and your brain are supposed to give you a warning that you're starting to get full, and also give you plenty of time to get there. So having urgency and having a rush to the restroom or having a uncomfortable sensation to urinate is not a normal part of a urinary function. So a lot of this reasons why people get overactive or spastic bladder or rectum is a breakdown in the communication between the bladder, the spinal cord, and the brain. Urologists surprisingly also deal with urge bowel incontinence. Gastroenterologists, when they see patients that have significant rectal urgency, will often try some conservative measures, and if they fail, they'll send patients to a urologist. The same nerves that go to the rectum are the same nerves that go to your bladder. So patients often have a combination of bowel urgency and bladder urgency, but they can have just bladder urgency or just bowel urgency. So it could be either one of those issues. So these are some of the causes of incontinence. Some medications can worsen urinary urgency, mainly diuretics. Diuretics typically last about 4 to 5 hours. And so sometimes after somebody takes a diuretic in the morning, they can get uncomfortable frequency and urgency. But it's usually pretty obvious when that's the cause because it started right after they started the diuretic. Other things that can cause like stress incontinence, which is pregnancy, childbirth, if you've had pelvic tumors and had to get radiation, or sometimes injuries can cause issues with the nerves that go to the bladder and rectum. Doctors love to break things down into categories. So we generally break urinary habits into 3 categories. The first one is stress incontinence. So stress incontinence is typically described as leakage when people cough, sneeze, laugh, or exercise. And that's anatomic loss of support of the urethra. So stress incontinence is a different diagnosis or different problem than overactive bladder. So overactive bladder is more frequency and urgency, and that's like a spasm of the bladder not as contracting when you're not over a toilet. Another issue is urinary retention. That can be from either weakness of the bladder, where the bladder can't give a good squeeze, or obstruction of the bladder. So part of what a urologist does is that initial visit is we try to talk about what are the symptoms. We sometimes will have to do some tests to find out, do you have stress incontinence, urinary retention, or overactive bladder? The tests are just easy office tests, which generally people don't find bothersome. But the first step of always trying to solve any kind of medical issue is getting the right diagnosis off the bat. A lot of times we can get the right diagnosis just simply by listening to people and doing a physical examination, but sometimes we have to do further tests, but they're all just easy office tests. So here's a further description of stress incontinence: leaking with coughing, sneezing, and laughing. Urinary retention is when the bladder is full and you can't empty it. Sometimes people have to catheterize as a temporary fix until we can find a better long-term solution. Nobody really likes having to deal with catheters. Overactive bladder. We spend a lot of time talking about overactive bladder because of the three problems I just discussed, it's by far the most common. That's more the bladder. It's an issue of storage of the bladder. Like I mentioned, there's two functions of the bladder. One is emptying, and the other one is storing urine. Overactive bladder is when the bladder does not do a good job of storing the urine. The little pictures next to the restroom is kind of a nice picture. It's like when you have to go, you have to go. Like I mentioned earlier, the nerves that go to your bladder also go to your rectum. So often patients can have fecal incontinence or rectal urgency. And it's really it's a very similar problem as overactive bladder. It's just affecting a different organ. So we're going to get into discussion of it. The first step is always getting a good diagnosis. That's getting a good history, doing a physical examination, and sometimes we have to do tests. If someone's, using excessive caffeine, we talk about minimizing it. There are sometimes we will discuss if it's stress incontinence using biofeedback or different ways to strengthen the urinary sphincter to help with the stress incontinence. And there are procedures also to help stress incontinence. There's really no good oral medications for stress incontinence. Oral medications are used more for overactive bladder. So here's some of the solutions: diet, exercise, physical therapy. The oral medications. The oral medications for overactive bladder can be fairly effective for people with mild overactive bladder, mild urgency, mild frequency, mild bladder discomfort. When they started getting into more moderate or severe symptoms, the benefit with oral medications can start to diminish a little bit. In general, oral medications will take someone with severe overactive bladder and make it moderate. If they have moderate, it'll make it mild. If they have mild, it'll make them pretty much more normal. The long-term people staying on oral medications isn't great, unfortunately. They can have some side effects. Dry mouth and constipation are the two main complaints with the oral medications to calm the bladder and improve bladder function. As you go higher on the dose with the medications, unfortunately, sometimes the dry mouth and constipation can worsen. So it kind of can limit the dose. But for people with mild to mild moderate overactive bladder, sometimes the oral medications can be very, very effective and people can tolerate them well. And as a general rule, we try oral medications because some people do tolerate them very well. And some people can really get a lot of benefit from them. So it's definitely worth trying them if no one's ever tried them in the past. A lot of times, by the time someone's seen a urologist, their primary care doctor has already tried some of the oral medications for the overactive bladder, frequency, and urgency. And like I said, there's really no oral medications for stress incontinence, which is leakage with coughing and sneezing, because stress incontinence is more of an anatomic issue. It's not, no medicines are really going to help that. But there are some simple treatments for stress incontinence if that's the primary issue. If someone fails medications and minimizing caffeine and conservative management, we'll sometimes talk to them about more advanced therapies for overactive or spastic bladder or spastic rectum. Of all the things a urologist does, this is probably the hardest one to explain. You know, severe and moderate overactive bladder is basically a loss of coordination between the bladder, spinal cord, and brain. And so the nerve that goes to your bladder is actually in your lower back. It's barely below the skin, so it's fairly easy to stimulate it. So that's one of the options. Botox is another option. That's Botox. Generally, women are familiar with it. It paralyzes temporarily some of the muscles. Your bladder is basically a bag that stores the urine, but has a layer of muscle around it, usually about almost a ½ inch thick. So it's a layer with muscle. And so if someone has a real spastic bladder in the office, we can inject Botox into the bladder wall. People do pretty well with the procedure. The main issue with Botox is it has to be repeated. It typically lasts about 4.5 months. It is covered by insurance, which people are surprised by, because when they think of Botox, they think of elective plastic, or elective stuff like having it injected in the face. But insurances do cover it. It can be an effective treatment. The main issue with it is it has to be repeated usually about 3 times a year. The main risk of Botox is if you relax the bladder too much. Sometimes people can have trouble emptying the bladder all the way. In general, men don't do great with the Botox bladder injection, so it's not used as much in men. It's used more in women, but it is definitely a treatment option for people with moderate to severe frequency, urgency, and urgent incontinence. Another option, which sounds it's a little bit hard to explain because it sounds a little crazy, but the nerve that goes to your bladder terminate ends in your leg, and so by stimulating that nerve, you can get return of coordination between your bladder and your spinal cord and your brain. And so people come in and they're here for about a ½ hour. They come in once a week for about 6 weeks or 12 weeks, and if they get improvement in their urinary frequency and urgency, they usually have to maintain it by coming in once a month for a ½ an hour. It sounds kind of crazy, but it's been around for a long time. It's been FDA approved. People do get benefit from it. If someone lives really far from an office, it doesn't really work out great, and it does require the maintenance of coming in once a month to maintain the benefit. It's more for people with mild and moderate symptoms. People with severe overactive bladder frequency and urgency, it generally does not help very much, unfortunately, but it is also covered by insurance. It's been around for about 15 years, and it's pretty effective for mild symptoms. And people that don't do well with medication and have mild symptoms is often a good option. For people with more moderate to severe symptoms who have failed medication and aren't interested in Botox or have failed Botox, by using what's called, the technical name is sacral neuromodulation. And that's where we stimulate the nerve that goes to your bladder and rectum. It can be used for either rectal urgency or bladder urgency, or both, because it's really the same nerve. Like I mentioned earlier, the nerve that goes to your bladder is barely below your skin in your lower back. So by stimulating that nerve, we can get return of coordination between your bladder or rectum, and spinal cord and brain, with a resolution or significant improvement in the urinary frequency and urgency. So if someone has really severe frequency urgency, you're going constantly, you're wearing a lot of pads, this is really about the only option that's going to really have a really significant improvement in their symptoms and quality of life. And I'm always surprised by how long some of them will deal with these issues. Like, I'll see patients that are wearing 2 or 3 pads a day. They're having to use a restroom every hour. They have bladder discomfort. And I ask them how long they've been dealing with this for. And they're like, oh, 5 or 6 years. And they haven't really seen anyone for it. It's, even though I've been doing this for a long time, I'm still surprised how long people will wait to come in and see a urologist, because, usually we have a high probability of fixing or significantly improving these symptoms. So there's no real reason to have to live with having to be constantly searching for a bathroom whenever you're going out. And also, people sometimes start to restrict their activities because they don't want to deal with public restrooms, or they don't want to travel because they don't know where the next restroom is. And so it can really affect their quality of life if they really have bad overactive bladder symptoms or have a rectal urgency issues. So the nice thing about the interstim or sacroneurostimulation is we get an opportunity to do a test to verify this technology will work for somebody. And so to do the test, the nerve, like I said, the nerves to your bladder and rectum are barely below your skin in your lower back. Just by taking numbing the skin, taking a needle and placing some nerves, placing some wires barely below your skin in your lower back, and have you wear the nerve stimulator for a few days, like, usually on average it's like 4 to 5 days. We can tell if this technology will work for someone. And so it's, say someone's got real bad frequency urgency or rectal urgency, and they haven't done well with medications, we can do a very simple test to see if this is a good option for them. And so the test is very easy to do. We put the wires in, see it back in the office 4 or 5 days later. And you basically, the patient tells us, hey, did this fix my problem, or did this really help a lot? So, 80–85% of people with moderate to severe overactive bladder or rectal urgency who do the test get at least 50% improvement in their symptoms during those 4 or 5 days. Most of them actually more than that. And so we know that they respond to this technology. And it's an easy thing to do. There's no incisions. It's just using a needle and numbing the skin. If someone does the test and they find out that, hey, this really worked for me, I want this improvement full time, to make it full time improvement, a little device there, we just make a small incision in the upper buttocks, numb the skin. So they'll get sedation for that, and then we can run the wire under the skin to where the nerve is. And that, the device lasts 12 or 15 years. There's no maintenance to them. They're MRI friendly. I mean, once they're in, they're in. And if after 15 years the battery runs out, to replace the battery is a 5-minute procedure. So this treatment option is very effective, very simple, very safe. And also we get to do an easy test to verify that it's going to work for that individual. So it's kind of a nice option. Probably move on to the question part of it.
All right, so thanks everybody. We're going to go ahead and put a poll up on the screen. It should allow you to make some choices on some questions that we have put in place. So go ahead and take some time to go through these questions. And then once you're finished, you should be able to submit. Give you a couple minutes here. All right, we're seeing some submissions here, so we'll continue to give you another minute or so. All right, so I'm going to go ahead and end the poll there. It looks like a good chunk of you participated. All right, that's it, Dr. Luke? Yeah, thank you everybody so much for joining. There will be an additional poll that's going to come up once I end this webinar. If you could go ahead and fill your answers out to that, that would be greatly appreciated. Otherwise, thank you guys so much for joining.
Thank you.
Hope you learned some valuable information.